Gemma is a 1-year-old mixed breed dog who was brought to the shelter by our law enforcement department after she and 4 other dogs were found abandoned in an apartment in Rochester. About 2 weeks after Gemma came in, she was in a foster home, and Gemma was not herself. She was more tired than usual. She didn't want to play with her toys and be as interactive. When she brought her in, we noticed that her gums were very pale, which indicates that her red blood cell count was very low. We could feel that there was something abnormal in her abdomen and took x-rays. We were initially worried that she maybe had a surgical emergency, and I did an exploratory surgery. Instead, I found that her spleen was incredibly enlarged, and I became suspicious of an infectious disease causing that. We ran a tick panel and ruled out the common tick diseases that we see around here. And I started thinking about a disease called babesia, which isn't very common. This disease can be transmitted by direct blood contaminations. Her red blood cell count was dangerously low, and she was not going to survive without emergency treatment. We don't usually perform blood transfusions at the shelter very often, and ended up having to call the emergency clinic to get some supplies. And one of our technicians' dogs became the dog blood donor for her. She was carefully monitored throughout the blood transfusion. We monitor her heart rate, her respiratory rate, and her temperature.
So far, so good.
The next day, she looked like a different dog. She was back to wanting to interact with people and playing with toys again. 2 of the other dogs in the house tested positive for babesia, but seemed to have gotten through that initial illness just fine and are not symptomatic for the disease. In cases like Gemma, if she hadn't received a blood transfusion, she would not have survived that initial infection. And luckily for her, she had come to us 2 weeks prior. She was in a foster home with somebody who was very attentive to her and attentive to just the subtle change in her behavior. And we were able to identify the disease early in its course and take the action we needed to save her life.